Salam alaikum. Now I would like to talk about delirium. Delirium means acute confusional state. Delirium means acute confusional state. In delirium, we actually see the cat level. That means confusion, decrease, attention, decrease, thinking, decrease, presence of hallucination. In delirium, there is visual hallucination. Visual hallucination. So attention spans decrease, uh, confusion decrease, thinking decrease, and there is a hallucination which is visual hallucination. It is characterized and there is disturbance in the sleep wake cycle, cognitive dysfunction, and it is actually reversible. Usually secondary to the identifiable illness, CNS disease, infection, trauma, substance abuse, or withdrawal, metabolic or electrolyte imbalance, hemorrhage, urinary or fecal retention, or medication like anticholinergic, especially in the older adult, it can cause delirium. Can cause delirium. Most common presentation of altered mental status in inpatient setting, especially in the ICU or during the prolonged hospital stay. Delirium uh, changes in delirium. There is changes in the sensorium. EEG may show diffuse background rhythm slowing. EEG may show diffuse background rhythm slowing. Treatment is identification and management of the underlying condition. Identification and management of the underlying condition. Orientation protocol. Keeping a clock or a calendar nearby. Keeping a clock or a calendar nearby. Decrease sleep disturbance and increase cognitive stimulation to manage symptoms. Antipsychotic haloperidol may be needed. Haloperidol may be needed. Avoid unnecessary restraint and drugs that may worsen the delirium. Avoid unnecessary restraints and drugs that may worsen delirium. Anticholinergic, benzodiazepine, and opioid. So these are the cause. The CNS disease infection. This is the cause: CNS disease infection, trauma, substance abuse, and this is treatment. We actually give uh, antipsychotic, haloperidol, and avoid unnecessary restraints and drugs that may worsen the delirium like anticholinergic, benzodiazepine, and opioid. These drugs are avoided. Now, psychosis, delusion, hallucination. First, I have studied delirium. Now, psychosis. What is psychosis? Psychosis is distorted perception of the reality characterized by delusion, hallucination, and disorganized thought or speech. It can occur in patients with psychiatric illness or another medical condition or secondary to substance or medication use. Distorted perception of reality characterized by delusion, hallucination, disorganized thought or speech. It can occur in patients with psychiatric illness. Now, delusion. Past psychosis. Psychosis can occur in patient with psychiatric illness or another medical condition or secondary to substance or medication use. Delusion is false, fixed, idiosyncratic belief that persists despite evidence to the contrary and are not typical of the patient's culture or religion. Uh, A patient who believes that others are reading his, it is erotomanic, grandiose, jealous, persecutory, somatic, mixed, and unspecified. Delusion is false belief, false, fixed, idiosyncratic belief firmly held by the person, not amenable to the reason or logic, not shared by the patient's community, not shared by patient's culture uh, or religion. Patient thinks or believes that someone is reading his thoughts. It may be erotomanic, it may be grandiose, it may be jealous, it may be persecutory, it may be somatic, it may be mixed and unspecified. Disorganized thought is word salad, tangential, and derailed, loose associations. Incoherent means word salad, tangential, and derailed, loose association. Hallucination is presence perception in the absence of external stimuli. Seeing a light that is not actually present. Hallucination means perceptions in the absence of, there is no external stimuli, but you are seeing something. That is hallucination. A contrast with the misperception, illusions of the real, illusions of the real external stimuli. Auditory, more commonly due to psychiatric illness, auditory more commonly due to psychiatric illness that neurologic disease. Auditory hallucination usually happens in schizophrenia. Visual hallucination usually happens in a neurologic disease, dementia, delirium, and drug intoxication that are psychiatric illness. So auditory for A for S, auditory for schizophrenia, visual for dementia, visual for delirium. Tactile hallucination means cocaine crawl is common in alcohol withdrawal and stimulant. Cocaine, a type of delusional parasitosis. Tactile hallucination happens in alcohol withdrawal and cocaine crawl. Olfactory hallucination happens in temporal lobe epilepsy. Burning rubber and in brain tumor. Burning rubber olfactory is boo. Burning olfactory, burning rubber, brain tumor. Gustatory seen in epilepsy. Hypnagogic just while going to sleep. It is seen in narcolepsy, and hypnopompic also seen in narcolepsy. Get pumped up in the morning occurs while waking from the sleep. Sometimes seen in narcolepsy, hypnagogic and hypnopompic. Contrast with the illusionation. Illusionation is a misinterpretation of the real external stimuli. There is a stimuli, mistaking a shadow for a black cat. Like there is a stick, but you are thinking that it is snake. So stick looks like snake. That is illusion, and that is all about delusion, illusion, hallucination, psychosis, and delirium. These are the very high yield concept for psychiatry. Hope you enjoyed.